This morning, we continue our You Are Not Alone series, exploring ways to stay mentally healthy. And we're taking a look at the efforts happening right here in Northeast Ohio to make people of color more comfortable with getting help.
I'm hoping that the Therapy Fund completely shifts our understanding of what therapy is, that we begin to understand it as more of a maintenance of ourselves as opposed to a last resort rock bottom situation.
Rachel Cargill, an Akron native, lecturer, and social activist, recently dedicated some of her work to helping Black girls, teens, and women find therapy from those who look like them. A space where more representation is needed.
As it stands, while African American people make up a little less than 20% of the population in this country, we make up less than 5% of the service providers. So if people of color want to be seen by providers that look like them, there's a shortage.
Organizations like Rachel's Loveland Foundation and the Magnolia Clubhouse in Cleveland are working to change that, providing resources to those in need by those who understand their needs. Angel Chapin, the clinical director at Magnolia, says that goes farther than most understand.
I think a lot of times people who have good intentions say things like, I don't see race, I just see a person. Well, no one would say to me, I don't see you as a woman, I can see you as a person. And so they shouldn't say to me, they don't see me as a Black woman. Being a Black woman is a huge part of my life experience.
Because treating mental health is a deeply personal and private experience. And while things like racial awareness are center stage in the news, microaggressions and bias aren't experiences typically shared out loud.
Racism is a big part of this country. It's a big part of what's happened to me in my life. And so someone who's not of color may not, they're not going to understand really how it feels to be the target of bigotry.
People of color, even if they haven't experienced direct racism, they may be people who have grown up fearing it. And so that causes this sensitivity and this hyper-awareness that contributes to anxiety.
And the hope is, with more representation, the stigma of getting help will be broken.
It shouldn't feel like a risk. It shouldn't feel like I've done something brave.
It shouldn't feel like you've done anything wrong. And for those curious about these organizations that we mentioned, we do have links on WKYC.com, Maureen.
Gosh, it was such a powerful perspective, Hollie. I'm so glad that you talked with them.